It's time for our Health Watch, and as always, we are joined by our friend of the show, Dr. Syed Hussain of Trinity Health of New England. Good morning.
Good morning.
Glad to have you back here in
Thank
person.
You.
Now, we have some winter-related health stories. I'm going to wait to save that specific one for last. It's pretty interesting. But first up, there's a new study that says having a smartphone may be harmful for kids younger than 12.
Yeah, so let's talk about this. So this adds to a growing body of evidence, and I know we've discussed it in the past, Symphony, of mental health issues and just overall health outcomes and the use of smartphones, especially in children and adolescents. So this is a large study. 10,000 or so individuals got published in a very reputable journal recently. And basically the outcome was, in a nutshell, that if your child owns a smartphone, 12 or younger, they may be more at risk for developing poorer health outcomes, including mental health issues, difficulty sleeping, obesity, difficulty concentrating at school than those that do not own a smartphone. Mm-hmm. And remember, this comes on the heels of a growing body of evidence, like I've mentioned, but also the former U.S. Surgeon General in 2023 came out with recommendations and advisory related to smartphone use and young children as well as adolescents, and advocated for tech-free zones and encouraged parents to have their children develop more in-person friendships and relationships to foster those, back to basics because of these concerns related to adverse health outcomes.
Yeah.
So the study researchers will now be looking at, okay, so what is it in a smartphone that is associated with more negative health outcomes? So more to come on that, but it does add to that growing body of research.
It's an entirely different ball game for kids these days versus when I was around 12
Absolutely.
and 14. We only had MySpace, Zanga back in the day. That's a throwback. But I was on my family's computer, desktop
That's
computer.
Right. And we
in
used
the
to
living
get
room.
time allotted. You can only be on that computer for a half hour or 45 minutes playing a game, and then it's back to the books or go outside and play.
Being outside.
That's right.
With real people.
That's right.
Okay, up next, there's a new study that shows the shingles vaccine may help slow dementia. So how does that work?
Yeah, this is very interesting. This is part 2 of a research study. We discussed the shingles vaccine and a research study out of Wales several months ago. And this study basically shows that there may be a decreased risk of developing dementia. And in those people who have dementia, who've gotten the shingles vaccine as opposed to those who have not, then there's a slower progression of disease and reduced risk of dying. So this is very promising. We don't know the why behind this. So the researchers for this study will be looking at what's behind this. Is it, there's some theories related to the immune system and tamping down inflammation, which long-term may lead to reduced risk of developing dementia. But just so viewers understand, so shingles, same virus that causes chickenpox, can impact 1 in 3 adults in the U.S. And the vaccine is recommended for age 50 and above. It's a 2-dose series to reduce the risk of shingles, which is a really painful rash. And as you grow older, the risk of complications from shingles rises. So hence the need for the vaccine. But this is something that is new that we didn't anticipate, and more research obviously is needed, but it is welcome news.
Good stuff. All right, now lastly, there is something called the winter vomiting disease, and it's reportedly out in full force now that we are in the winter season. What can folks do to protect themselves against it?
So this is the guest nobody wants at their party, but
yes.
To your point, it's the season now. And last year we saw a surge in terms of norovirus-related illness. Norovirus is the leading cause of acute gastroenteritis in the U.S., which leads to nausea, vomiting, diarrhea. Some people may experience body aches and fever. It's usually self-limited. Symphony, 24 to 72 hours, symptoms resolve. There's no treatment per se except for hydration and taking care of yourself, making sure you're observing hygienic standards. Make sure you don't attend a party or something, 2 days or so after resolution of symptoms, because you can still be a carrier.
Gotcha.
How do you prevent this disease from happening? So it's the basics. So wash your hands with soap and water for 20 seconds at least per the CDC. This is one of those instances where hand sanitizer will not suffice. It won't be sufficient. So make sure you do that. And then wash your vegetables and fruit Make sure you cook your food at least 145 Fahrenheit. So all those things taken together hopefully will, prevent this outbreak from happening, but keep your eye on anybody who's sick. Also, one more thing, disinfect common surfaces where people may touch, whether it's toys, it's countertop, things that, have a high use in terms of people touching.
All right, definitely have to keep those safety tips in mind, just in general for all kinds of illnesses.
That's right, 100%.
Yeah. All right, well, thank you so much for joining us.